For my Unit 4 psychology project, I did ADHD. Brief description of ADHD is it's characterized by a persistent pattern of hyperactivity and impulsivity and or inattention that interferes with functioning and presents itself in two or more settings. Symptoms are usually shown before the age of 12, and they must have a negative impact on your life. There are three types of ADHD: inattentive, hyperactive, impulsive, and a combination of both. Some symptoms of ADHD are fidgeting, tapping hands or feet, squirming while seated, moving around when expected to be seated. And this will affect you because teachers, classmates, and coworkers may get frustrated with the excessive noises and movements that are being made. Another symptom is difficulty with completing tasks that require sustained attention, and someone who can't stay focused will not be able to complete tasks in a timely manner. Rapid shifts in emotion, getting frustrated easily, feeling overwhelmed fairly quickly. Someone who gets frustrated and overwhelmed quickly may not be able to fully complete everyday tasks. The biopsychosocial causes of ADHD. ADHD is likely a result of genetic makeup and early life events. 70 to 80% of people with ADHD can be explained by their genes. Environmental factors include events like before, during death, as well as childhood stress can contribute to the development of ADHD. Brain injuries, nutrition, and social environments may increase the risk of developing ADHD. Also, individuals who tend to get bored frequently and intensely are more likely to engage in risky behaviors, and as a response to boredom, people with ADHD may engage in unwanted or dangerous behaviors. An effective group: anyone can get ADHD as long as the symptoms have begun before the age of 12. However, boys and men display much more hyperactivity and impulse symptoms. Girls can still get ADHD, but their symptoms are a lot less severe and harder to detect. How is ADHD treated? Biomedical treatment. Stimulant prescriptions are the most common treatment for ADHD. Stimulants increase levels of brain chemicals involved in the thinking and attention side of the brain. Stimulants can have side effects, so they must be prescribed and monitored by a healthcare provider. It being monitored by a healthcare provider allows them to decide what dosages and what specific medications are right for you. Talk treatment that you can use is cognitive therapy. It can help patients cope with challenges that arise on a daily. It may help them gain confidence in themselves and to help them manage their behaviors. It allows the patient to work on skills to improve focus and organization in order to complete daily tasks. It also helps individuals recognize unhelpful thoughts and replaces them with more positive thinking. This helps reduce frustration and failure, and overall it helps with strategies to improve focus, helps to control impulsive behaviors, and helps with time management and organization. Active treatment. Individuals with ADHD often feel isolated and alone, and group therapy has become a source of hope for ADHD patients. The group therapies aim to create a safe and supportive space for all patients with ADHD, and it allows them to discuss their thoughts, feelings, and emotions openly. Individuals who are dealing with similar issues, it allows them to make connections with others, which is very helpful. Participants share experiences, receive encouragement, and offers support to one another. It allows individuals who have ADHD that are feeling isolated and alone to have a space to share their thoughts and thoughts openly without any judgment. And then this is the sites page, and this is the whole entire slideshow again. Thank you.